What is the number one thing that everyone should know about strokes?
I think recognising when someone's having a stroke is really important and acting really quickly. So you might have heard of it, but it's worth reiterating. Fast. So is a person's face, has there been a change in it? Has that smile drooped, or has one side of their face drooped? And that can be a sign of a stroke because the muscles weakening. So that's one. Now, A for arms. Again, similar thing. You lift both arms up, and if one's weaker than the other, it's an obvious problem with one of them. That's another sign. Next one, speech. Is a problem with speech or language. It could be slurring of words or just problems comprehending. That is the S. And then the T in fast is the time is act quickly. The quicker you act, the better. Simply because if you've got a problem with the blood supply in your brain, you want to unblock it or deal with it. So around 85% of strokes are blockages, and they can dissolve that if you get in quickly. So it's really important to act quick, get onto the phone, 999, explain you think it's a stroke, and hopefully they can deal with it quickly and limit the damage, and that's the key.
And if you think somebody is having a stroke, what would you advise people to do?
Call 999 immediately and explain you believe a person's having a stroke. They might ask some further questions, but they'll guide you. They might want to know the age or the gender, anything like that. They'll ask you relevant questions. But the most important thing you can do is tell them you feel someone's having a stroke, and then they'll come and deal with it. Hopefully they'll come quickly, and then they'll just follow the stroke protocol, and we hope get in quickly, deal what they need to do, limit the damage, and they'll be in the right place. If they're having a stroke, they need to be in hospital to get dealt with.
And what advice would you have for somebody who's had a stroke recently themselves, or for their friends or family?
So, it depends on the severity of the stroke. If you got in quite quick, hopefully any lasting damage or repercussions will be minimal, but sometimes it's not, because there might be a slight delay in dealing with the stroke. So first thing to do is make sure you get all the advice you need when you're in hospital. Be comfortable, ask questions. This is for family and obviously the person who's had the stroke if they're able to. Just don't leave with questions. You need to have everything answered, and just find out what the next steps are, what further support there will be for you. That's really important. In terms of recovery, it generally, you have a thing called spontaneous recovery, which happens in the first few months, but it's also aided rehab. It could be speech and language therapy, it could be work with a physio just to get movement again. But it only comes to a certain point, so it might be up to about a year that might be how far you're going to get. But then it's a case of living what you've got, which stroke is very common now, and there's you can get tools and you can get around things. It's a change in your life. Maybe it takes you a bit longer to get ready or to communicate with someone, but you adapt, and there's certain things you can do. You can, for example, carry a card around saying, I've had a stroke, please give me time to answer. So that's if you've got processing problems, because the problem is it's a bit of an invisible disability. So if you're out and about, people might not realise what's happened to you, and you need a bit more time to process a question they've asked you, and they might not give you the time because they're not mind readers, they don't know what's happening. So if you carry a card around, like for a cashier or bus driver or anyone, saying, I've had a stroke, give me a bit more time to answer, that's really helpful. So small things you can do which will actually help you. And if you're a carer, it's just, it's a change in your life, how you're going to communicate with someone who's had a stroke. So speak slowly, face the person so they can maybe lip read, give them time to answer, and just be aware of what their strengths and weaknesses are now. They haven't lost intelligence. If you had a stroke, you haven't lost intelligence. You've just maybe lost a bit of processing of, you need more time to comprehend. You might struggle to get some words out, but that's something you can still get around. It's not the end of the world, and I think you just need support of people around you and understanding people. And if you don't know something, you don't get something, there's support groups out there. There's a Stroke Association website, and hopefully access to some professionals still, where you can ask them some of these questions. And I hope everything works out for anyone who has one. Sadly, it's very common, and we hope videos like this will help educate people.
And if people want to know more about strokes, where would you recommend they find more information?
So, sources of information, the big one's the Stroke Association. They have a helpline, many leaflets. They have a search facility where you can put your postcode location in to try and find local support groups. And you just got to see what's running at any time. They tend to be during the week, during the day, which should fit in with quite a lot of people. Strokes can happen to anyone at any age, but they do tend to happen to older people and perhaps retired people, so I think they tend to put support groups on during the week, during daytime, when they get staff as well. So that's a good avenue. So look at the Stroke Association website, and if you've got access to professionals as well, so have a chat with them if there's a stroke specialist. You can always go to your GP if you need to ask something. If you're worried about something getting worse, then you should go there. But in any case of any emergency, because once you've had a stroke one time, you could be at a higher risk of having another one. Hopefully not, but again, know the fast, know to act quickly, and then deal with it. So time is always really critical. So my name is Rajan Nair. I'm a volunteer at Healthwatch. I used to work on stroke wards, and I've also worked in working with people with aphasia, which is problems with language, comprehension after a stroke, and I've been an advocate for stroke survivors and care homes. So I've got experience from different angles, and I'm very passionate about getting the word out about stroke. So I do give talks about that, and that's me.